Hey y'all, welcome and welcome back to my channel. So it is Nurses Week, and during this time of the year, myself and I'm sure every other nurse out there tend to reflect on why we decided to become one. So for today's video, I would like to address aspiring nurses. I believe that there are 5 things that each aspiring nurse should ask themselves before even thinking about becoming a nurse. Nursing, while it's a very rewarding career field, it comes with a whole lot of challenges. And unfortunately, nursing school doesn't prepare you for all of the obstacles that you will face while you're in the nursing field. So if you are interested in a career in nursing, one thing that you should ask yourself is, how do I handle stress? How to have emotional intelligence to work as a nurse, because not only is being a nurse stressful, but the process leading up to becoming a nurse is stressful. And nursing school is not for everyone. A traditional LPN, LVN, RN school will put you through a series of tests, quizzes, simulations, and on-the-job training that you have to complete and be successful at in order to prep you for taking the NCLEX. So the NCLEX is the National Licensure Examination. Passing the NCLEX means that you have met the minimum basic requirements to be able to perform as a nurse. And mind you, in the US, the NCLEX exam has been labeled as one of the most difficult exams to pass, because not only are you being tested on your knowledge, but you're also being tested on how you will apply that knowledge to real life situations. So back to the question, how do I handle stress? So we all know that stress is a normal part of life, but as a nurse, how you respond to stress not only affects yourself, but it affects your patients, it affects your coworkers, it affects everyone around you. So if you respond to stress by snapping at people, having angry outbursts, becoming very irritable, or indulging in unhealthy habits, then nursing may not be for you. Another question you want to ask yourself before even thinking about becoming a nurse is, do I work well with others? Are you a team player? So most nursing positions require that you interact with not only with your patients, but you have to interact and communicate with your coworkers. So that includes other nurses, physicians, therapists, social workers, dietary, nursing aides, and administrators. And as you know, as you start to work with different people comes different personalities, okay? So you may have people that have varying values, beliefs, opinions, work ethics. So as a nurse, it's important for you to recognize those differences, but not allow that to hinder you from providing the best care possible for your patients. So research has shown that even with all of the challenges, having good teamwork increases the nurse's satisfaction with that job, as well as retain those nurses. So if you do not work well with others, nursing may not be for you. Another question to ask yourself is, am I a critical thinker? So nursing involves applying the knowledge that you learned to real life situations. Nurses are problem solvers, and in many cases we have to make quick decisions in such a short amount of time while under the pressure. Y'all, this is a little side note. So I have a friend that is a nurse, and many years ago she had taken her child to the ER because her child has a small object lodged in their ear. Well, anyway, the ER doctors were not able to take out the object at the bedside, so they start talking about surgery. She, examining the room, realized that they had a wall suction in their ER room. She suggested to the doctor that they try suctioning the object out of the ear before considering surgery. And y'all, how about it worked? So y'all, even though this isn't a usual practice, they tried it, it worked, it caused no harm, and it avoided her child from having surgery. So y'all, that is critical thinking. Critical thinking is a skill. You make those connections to make the best possible clinical decision for your patient or your child. So if you are not a critical thinker, then nursing may not be for you. Another question to ask yourself is, am I adaptable? As a nurse, you must be adaptable with your patients and with healthcare. As a nurse, you will see and treat patients with all types of various needs, and you must be able to adapt yourself to every need that your patients have. And keep in mind that some of those situations that you may have to adapt to may not be the most comfortable situation for yourself as a nurse. And in regards to healthcare, as we learn more information, as more outcomes are revealed through these evidence-based studies that are being completed, then the way that we approach healthcare and medicine, it changes. So something that you may have learned 15 years ago while in nursing school may not be the best or the most safe practice by today's standards. And as a nurse, you must be able to adapt to those possible changes. Another side note is that when I began my nursing career 15 years ago, we did most of our charting on paper. I remember in some of those facilities, as they started to introduce computerized or electronic charting, there was a lot of kickback from the nurses. But as a nurse, you have to be able to adapt to those possible changes. So if you are closed-minded, inflexible, and unadaptable, then nursing may not be for you. Another question to ask yourself is, do I lack empathy and compassion? So compassion and empathy are often confused with one another, and although they do have a lot of similarities, there are some differences. In layman's term, empathy is the ability to put yourself in someone else's position. Someone who isn't empathetic tends to label people and their circumstances without even knowing any type of context behind their situations. They are critical, they're judgmental, and they tend to have the attitude that it'll never happen to me. Sometimes these type of people tend to make jokes about people and their circumstances and even their emotions. And then for the person that is emotional, they label them as being too sensitive. Anybody else feeling triggered? Because I am. And a lot of these type of people do not realize and do not care about how their actions and behaviors affect others around them. So let's talk about compassion in nursing. So compassion involves having empathy and the desire to help someone when they're in need. A compassionate nurse is an active listener, and they really take their time to get to know their patient so they know exactly what their patient needs from them. And also they have a better understanding of what their patient is going through. So there have been some studies that shows that patients that view their nurses as having empathy and being compassionate tend to have a better overall perception of the health care that they received, even if they did not have the best outcome. So y'all just think about that. You may have a patient that have had a poor outcome, but because they viewed their nurse as having empathy and being compassionate, they were overall satisfied with their care. So with that being said, if you lack compassion and empathy, then nursing is not for you. So although I believe that empathy and compassion is something that you either have or you don't have, there are many psychology experts that believe that these are traits that can be improved and developed over time. But you must also consider that you must have the emotional intelligence to even be aware that you're lacking it, okay? So that concludes today's video, and I hope that I provided some information that was helpful to someone out there. And if there are any nurses out there, what questions do you believe that an aspiring nurse should ask themselves before even consider becoming one? Also, if nursing content is your drug of choice and you want a little fix, then don't forget to like, comment, and subscribe to join our unit. Thank you. Bye-bye.